Welcome back to Thrani, I'm Joe B. Today I'll show you how to fix a pelvic or an iliac anterior rotation through muscle energy techniques and exercises. Let's dive in. Pelvic or iliac anterior rotation is when the ilium gets stuck, rotated forward. The cause of this can be due to repetitive cutting and excessive trunk twisting, which can result to the anterior superior iliac spine bony landmark, or the ASIS, to be lower on that side. There is also left lower extremity elongation, right sacral rotation, and since the lower lumbar spine stays in neutral, it would seem like it rotates to the left. Iliac anterior rotation can bring about low back pain below the belt line in a rectangular pattern. Running, walking, and stair climbing can also increase the pain. And the patient can feel off-kilter during walking due to a leg length discrepancy. The assessment for anterior iliac rotation requires the patient to do bridging first to balance the pelvis, and then be in supine with hands at sides. The therapist will be at the foot of the table with both hands at the malleoli, such that the thumbs are on the medial malleolus and the lateral forefingers are at the lateral malleolus. From there, the therapist passively extends the knees to check malleolar symmetry. Normal findings is that the medial malleolus will be symmetric in supine and long sitting. Abnormal findings is that the lower extremity is longer in supine but becomes symmetric with the right lower extremity in long sitting. To treat, let's assume that the right side has the iliac anterior rotation. The patient will be in left side lying with hip and knee flexed and placed on the therapist's right hip for support. The therapist cradles the patient's leg with the right hand on the medial knee, while the left heel of the hand is placed on the ischial tuberosity with the left ring and little finger at the SI joint, or the sacroiliac joint. The therapist flexes, abducts, and laterally rotates the hip until a movement limitation is felt. From there, the patient is instructed to straighten the leg to match the therapist's resistance for 6 seconds. Then more flexion, abduction, and lateral rotation is introduced, while the heel of the left hand presses the ischial tuberosity to encourage more posterior iliac rotation. This is repeated for 3 to 5 reps. Stand to sit exercises can be provided for the patient to reduce or eliminate the likelihood of iliac anterior rotation recurrence, since sitting promotes hip flexion, which stretches the posterior hip structures and pulls the ilium into posterior rotation. This is performed for 2 sets of 10 reps. You can also perform single knee to chest stretches for 3 reps, 30 seconds each, as it attains the same iliac posterior rotation mechanics that counters anterior iliac rotation. So do you want to know how to correct a posterior iliac rotation or a posterior pelvic rotation? If so, then watch this next video. Thank you so much.